Welcome to this week's edition of Cardiovascular Updates, covering the latest breakthroughs. Brought to you by LucidQuest. A new non-invasive approach to screening for heart failure is showing strong potential. The combination of the Vivio device and the Kansas City Cardiomyopathy Questionnaire effectively identified undiagnosed heart failure in older adults. Notably, 38.5% of participants showed elevated left ventricular end diastolic pressure. Women and patients with chronic kidney disease were at higher risk, opening the door to earlier and more precise interventions. Gentuity and GE HealthCare have announced a strategic collaboration to improve access to advanced imaging in interventional cardiology. This partnership centers on co-marketing and integrating Gentuity's VisRx catheter and high-frequency optical coherence tomography technology, with the goal of enhancing diagnostic precision in PCI procedures. SGMC Health has been recognized for the 12th consecutive year with the American Heart Association's Gold Plus and Target Type 2 Diabetes Honor Roll Award. As the region's only accredited primary stroke center, SGMC emphasizes early recognition of stroke using the BeFast protocol. APC Cardiovascular is expanding through the acquisition of Precision Surgical, a move that strengthens its position across multiple surgical specialties. Precision Surgical brings a portfolio that includes ENT, neurological, orthopedic, and cardiac devices, enhancing APC's service capacity across both NHS and private hospitals. A new study has linked Pregabalin to an 85% higher risk of heart failure compared to gabapentin among Medicare patients. The findings suggest that Pregabalin's higher receptor binding affinity may underlie its increased cardiovascular risk, prompting calls for more cautious use, especially in older adults. Researchers have introduced a novel bioimaging technology that uses electrowetting instead of mechanical components for optical coherence tomography. This innovation offers high durability and lower power consumption with a resolution of 5 to 10 microns. Successfully tested on zebrafish retina, the device shows promise for use in coronary and ocular diagnostics. In a head-to-head trial involving over 13,000 patients, Mounjaro demonstrated significant cardiovascular benefits compared to Trulicity. The results include an 8% reduction in major adverse cardiovascular events and a 16% decrease in all-cause mortality. Additional benefits were noted in A1C reduction, renal protection, and biomarker improvements. The findings will be presented at the European Association for the Study of Diabetes 2025 annual meeting and submitted for regulatory review. Omron's suite of smart devices, including blood pressure monitors, ECG tools, and body composition analyzers, have helped detect early signs of heart failure in 33% of users. With over 90% adherence and 86% satisfaction, these tools are enabling earlier intervention through daily remote monitoring. At NHS Golden Jubilee, the adoption of Avere VR leadless pacemakers marks a significant step forward. These devices are 10 times smaller than traditional pacemakers and offer a battery life of up to 25 years. Implanted directly into the right ventricle, they eliminate the need for leads and reduce the risk of chest scarring, making them ideal for active individuals and patients with prior infections. Takotsubo syndrome, also known as stress cardiomyopathy, is emerging as an underdiagnosed condition in ICU settings. Often mimicking a heart attack, it requires a different clinical approach. The findings highlight the urgent need for advanced monitoring protocols in critical care environments. And finally, the National Institute for Health and Care Excellence has endorsed 6 digital cardiac rehabilitation platforms for a 3-year trial. Tools such as MyHeart, QIActive, and HeartBuddy will offer home-based rehab, patient education, and wearable tech integration. The initiative aims to reach underserved populations, including women and minorities, who are often underrepresented in traditional rehabilitation programs. Stay ahead in cardiovascular research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com.